Hi friends, in this session I'm going to talk about a very simple topic, types of infection. So what you will be seeing is how we are going to classify infections depending on their prevalence, depending on the severity, the patterns of infection and various other factors by which we are going to name the different forms of infection. And we are also going to see what is the difference between infection and infectious disease. Okay, shall we start? Before we talk about the types of infection, let us first understand a few common terms that we are going to use here. So when we say that a host is interacting with a microorganism or the vice versa, we will come across two terms. One is a saprophyte, the other one is a parasite. This is the term given to the microorganism that is interacting with the host. A saprophyte is a microorganism even if it enters inside the human body. Here we are talking mainly about human beings and their diseases, so we shall restrict ourselves with human body. So when we say a saprophyte is a microorganism which is dependent only on dead organic matter. So even if such a saprophyte enters inside the human body, it will not interact with the human body in any way. Since it does not interact with the human body, it is not at all important for us as far as medical microbiology is concerned. Because we are not bothered with biodegradation or bioaugmentation or any such thing. We are here talking only about diseases for which saprophytes does not have any role at all. Now, the other group is a parasite. Parasite is a microorganism which is going to depend on living substance or living cell. So this is the one we are concerned with in medical microbiology. So any microorganism that interacts with the human body, that interacts with the human living cell is going to be a parasite. But even in parasite we have two groups again. One group is the pathogen, the other group is the commensal. A parasite, when interacting with the human body, causes some kind of discomfort to the human body, or we shall say a disease in the human body. Such a parasite is going to be called a pathogen, or simply speaking, a microorganism which causes diseases in the human body is going to be called a pathogen. But there is another group of parasite called commensals. We have already seen what is a commensal organism in human microflora, isn't it? A commensal organism also is dependent on the human living cells, but here this group does not cause discomfort or disease in the human beings. In fact, they sometimes even be beneficial to the human beings. So such a parasite which exists in coordination with the human body, human living cells without causing disease is going to be called a commensal. But we cannot be 100% safe with the commensal organism also. Why? Because some of these commensal microorganisms will not keep quiet if the human immune system fails. If the defense system in the human body fails, some of these commensal organisms also can cause diseases, and such commensals are called facultative pathogens or opportunistic pathogens. So it is these group of microorganisms we are mainly concerned with as far as medical microbiology is concerned, as far as microbial diseases are concerned. Fine. Now we are going to find out what is the difference between infection and infectious disease, because both are not same. Infection is when a parasite enters inside the body, starts growing and multiplying within the body. That condition is called infection. The host is said to have an infection when the pathogen or the parasite enters the body and starts multiplying. But At this stage, you might not see any symptom. It might not even result in a disease, because once the organism starts growing, the body will recognize it. It will stimulate its immune machinery, and it will most of the times eliminate this organism from the human body. So in that case, even if there is an infection, it might not lead to worse situations. So this condition is called infection. Let me repeat. Infection is a condition where a parasite enters inside the body and starts growing and multiplying in the body. And that condition of the host is said to be having an infection. And as I said, infection need not result in a diseased condition. Whereas, if you see infectious disease, let us understand this later. I will just put it in a simpler way. Infectious disease is a condition where the parasite has entered inside the body, it has multiplied inside the body, and because of its growth and because of its various products that is released from this organism, this body will start finding some discomfort. For example, in the respiratory tract, a normal function, breathing would have been affected. In the gastrointestinal tract, the normal function of digestion would have been affected. In the urinary tract, the normal function of urination would have been affected. If such a thing happens, only then we call it as a disease, that too infectious disease. If it has been caused by a microbial parasite, then we call it as infectious disease. So let us see the definition now. Any change from a state of health in which part or all of the host body is not capable of carrying on its normal functions due to the presence of a parasite or its products. So as I said, simply speaking, when a normal function of the body is affected because of the parasite or its products in the sense it could be a toxin or an enzyme or some kind of an antigen. Okay, so because of the presence of the parasite or its products, if the normal function of the body is affected, and if you start seeing symptoms, that is when we call it as infectious disease. In fact, disease term itself is very general, because we have diseases like physiological diseases are there, genetic diseases are there, in deficiency diseases are there, but they are all different from this infectious disease. Here, disease is caused by a microbial parasite or a pathogen. Okay, let us see these two terms of infection together, because they are always used simultaneously. Primary infection and secondary infection. One without the other will not be that meaningful. Okay, so primary infection is first infection that often allows other organisms to invade host at that site. What is this? See, there will be a healthy human host. The organism enters inside that host, and it creates certain changes in the host, so that other organisms will now start attacking that host. So such an infection, that first infection, is called the primary infection. For example, HIV infection. See, in a normal healthy human being, the HIV virus enters, it starts growing. Slowly our immune system will start getting affected, and because of this immune deficiency, other organisms will start attacking the human body. So HIV is the primary infection, and other organisms which attack the body later are called secondary infections. Fine. Now, what is a secondary infection? When a new pathogen sets up an infection in the host whose resistance is lowered by a pre-existing infectious disease. As I said, because of HIV infection, the host resistance has been affected. And at that condition, a new organism enters inside and start attacking the body. Here, I have just mentioned one example, tuberculosis disease. See, tuberculosis is caused by Mycobacterium tuberculosis, a bacteria. In a normal healthy patient, usually Mycobacterium tuberculosis cannot cause the disease. But in a HIV patient whose resistance has been lowered considerably, the Mycobacterium tuberculosis can easily cause TB disease. So in that situation, we are going to call Mycobacterium tuberculosis as the secondary infection. Depending on the pattern of infection that is seen in the human body, we have three different terms of infection: localized infection, systemic infection, and focal infection. A localized infection is the one in which the pathogen is restricted to one site. ಎಲ್ಲಿ ಎಂಟ್ರಿ ಆಗುತ್ತೋ, ಎಲ್ಲಿ ಮಲ್ಟಿಪ್ಲೈ ಆಗುತ್ತೋ ಆ ಸೈಟ್ ನಲ್ಲೇ if it shows the symptoms, then it is called the localized infection. For example, abscess. So abscess another, it is a localized infection on the skin where there is collection of pus surrounded by inflamed area. Very simple term alli andre boil anta ಏನು ಹೇಳ್ತೀವಲ್ವಾ. So skin ನಲ್ಲಿ ಸ್ವಲ್ಪ pus formation ಆಗಿ ಸ್ವಲ್ಪ red region, surrounding region ಇದ್ರೆ, that is called abscess. So this is restricted only on the surface of the skin, especially in a particular area. So such an infection is called a localized infection. Whereas systemic infection is when the infection spreads to several sites and tissue fluids, usually through circulation. Bloodstream allo, illa cerebrospinal fluid allo, illa through nerves. If the infection spreads to other parts of the body, giving symptoms in other parts of the body, then it is called a systemic infection. And the best example for systemic infection is typhoid. It might enter through the contaminated food. So initially it will be in the gastrointestinal tract, but through blood it will start going to other parts of the body and it will start showing symptoms in other parts also. So that is one example. We have so many such examples for systemic infections. Your viral diseases like measles, rubella, chickenpox, AIDS, idella kuda a systemic infection. Through blood it gets spread to other parts of the body. Bacterial diseases anta nodidre brucellosis ide, anthrax, as I said, typhoid fever, syphilis, all these infections are systemic infections. And there is another term used here, that is focal infection. See, what is this? When an infection is said to exist when the infectious agent breaks loose from a local infection and is disseminated into other tissues. See, initially the infection will start like a local infection, and then slowly if it starts getting spread to other parts of the body, maybe the organism itself is moving, or most of the times the organism's product like a toxin or an enzyme, if that starts moving and starts showing symptoms in other parts of the body, then that is called focal infection. For example, we have streptococcal pharyngitis here. See, here basically the infection is present in the upper respiratory tract, pharyngeal region alli irutte. Inflammation will be seen in the pharynx, but the streptococci will release its toxins, and these toxins will get spread to other parts of the body, causing symptoms in other parts of the body also. So such an infection is called a focal infection. Next, based on the severity of the infection, we use different terms here. First one is acute infection. If the infection comes very rapidly with severe effects, but the effects are very short-lived, such an infection is called an acute infection. Infection ಆದ ಕೂಡಲೇ symptoms ಕಾಣುತ್ತೆ, ಬಟ್ ಆ ಸಿಂಪ್ಟಮ್ಸ್ ತುಂಬಾ ಸಿವಿಯರ್ ಆಗಿರುತ್ತೆ ಇನಿಷಿಯಲ್ ಪೀರಿಯಡ್ ಅಲ್ಲೇ, ಬಟ್ ಎಷ್ಟು ಬೇಗ ಬಂತು, ಎಷ್ಟು ಬೇಗ ಸಿಂಪ್ಟಮ್ಸ್ ಕಾಣುತ್ತೋ ಅಷ್ಟೇ ಬೇಗ ಸರಿನೂ ಆದರೆ, then such an infection is called acute infection. For example, influenza, ಏನ್ ಫ್ಲೂ ಅಂತ ಕಾಮನ್ ಆಗಿ ಹೇಳ್ತಾರಲ್ವಾ, ಕಾಮನ್ ಕೋಲ್ಡ್ ಅಂತ ಇಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತೀರಿ, ಬಟ್ ಫ್ಲೂ ಅಂಡ್ ಕಾಮನ್ ಕೋಲ್ಡ್ ಆರ್ ಟೂ ಡಿಫರೆಂಟ್ ಇನ್ಫೆಕ್ಷನ್ಸ್, ಬಟ್ ಸಿಂಪ್ಟಮ್ಸ್ ಸೇಮ್ ಆಗಿರುತ್ತೆ ಎರಡರಲ್ಲೂ ಕೂಡ. ಫ್ಲೂ ನಲ್ಲಿ ಏನಾಗುತ್ತೆ, the organism has entered the respiratory tract, you start seeing the symptoms like sneezing, coughing, fever, headache, all body ache, all this will be there. It will be very severe for the first 3 or 4 days. Slowly, our immune system will take over. Slowly, you will start the diminishing symptoms. Within a week or 10 days, you will be completely, you would have completely recovered from flu, right? So this is what we call acute infection. ಎಷ್ಟು ಬೇಗ ನಿಮಗೆ symptoms ಕಾಣುತ್ತೋ ಅಷ್ಟೇ ಬೇಗ ಅದು diminish ಆಗಿ disappear ಆದರೆ such an infection is called an acute infection. Whereas chronic infection is infections that progress and persist over a long period of time. In fact, even till death, sometimes some infections will be there. So such an infection is called chronic infection. Andre, infection has happened in the body and it will be there for years together. You can give so many examples here. One is very common, one is HIV. Once infection bandre nimage ಸಾಯುವವರೆಗೆ ಆ ಇನ್ಫೆಕ್ಷನ್ ಅನ್ನ ಕ್ಯೂರ್ ಮಾಡಕ್ಕೆ ಇಲ್ಲಿವರೆಗೆ ಡ್ರಗ್ಸ್ ಇಲ್ಲ, ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲ. So the infection will be there for years together, 20 years, 30 years, continuous ಆಗಿರುತ್ತೆ. ನೀವು ಎಷ್ಟೇ treatment ತಗೊಂಡ್ರು ಕೂಡ you will be protecting yourself from only secondary infection, but HIV infection will be there, right? So anta infection and even tuberculosis infection, if you see, you will have that infection for 10 years, 15 years, 20 years, aa tara irutte. Of course treatment is there for TB, but again the infection period is very much prolonged when compared to influenza, right? Within 1 week, 10 days alli hoguva infection alla idella. It will take years together. So such an infection is called a chronic infection. The next one is a latent infection. The pathogen remains inside the tissue in the latent form for a long period. Slowly it will be proliferating and producing clinical disease when the host resistance is lowered. So almost chronic infection tarane, but illi ಏನು difference ಅಂತಂದ್ರೆ this organism would have entered inside the body and it will be present in the body silent for a long period of time. ಏನು multiplication ಇರಲ್ಲ, growth ಇರಲ್ಲ, symptoms ಏನು ಇರಲ್ಲ, organism ಇರುತ್ತೆ ಒಳಗಡೆ, but ನಮಗೆ ಗೊತ್ತೇ ಆಗಲ್ಲ. It will be present in the latent form or in the hidden form inside the body for a long period of time. It will slowly start proliferating and cause disease. Yavaga? Only when the host defenses is affected. Host defense, for example, diabetes ittu, sudden agi nimage sugar bantu, illa BP ಹೆಚ್ಚಾಯಿತು, illa ನೀವು ಯಾವುದೋ ಕಾರಣಕ್ಕೋಸ್ಕರ steroid drugs ತಗೊಳ್ತಾ ಇದ್ದೀರಾ. So in all these situations, your body's immune system will come down. So at that time, this hidden microorganism, this hidden parasite will start proliferating and cause the symptoms. So such an infection is called the latent infection. For example, herpes simplex virus, which causes herpes disease in human beings. This is such a virus. In fact, HIV kuda anta virus e. ಸ್ವಲ್ಪ ಡಿಫರೆಂಟ್ ಇರಲಿ ಅಂತ ಇಲ್ಲಿ herpes simplex virus ತೋರಿಸಿದ್ದೇನೆ. HIV also does the same thing. It enters inside through blood or other body fluids and it will go inside the cell. It will be present inside the cell as a latent virus for years together. If your immune system is really good, it will not grow for a very long period of time. It will be present in the latent stage. But once immune system drop adamele, it will start proliferating and it will start showing the symptoms in the body. So such an infection is called the latent infection. The last one is inapparent infection. Here infection has happened, microorganism has entered inside, but you will not see any clinical effects in the body. No symptoms will be observed at all. So such an infection is called inapparent infection. Based on the source of the pathogen which causes the infection, we use two terms again. One is the endogenous infection, the other one is the exogenous infection. Endogenous infection is when an infection is caused by an infectious agent that is already present in the body, but it has previously been inapparent or dormant. Andre organism already ಬಾಡಿಯಲ್ಲಿ ಇದೆ, but ಅದರಿಂದ ಯಾವ symptom ಏನು disease ಏನು ಆಗಿಲ್ಲ. But when the conditions are favorable, it will cause the disease. So such an infection which is caused by the organism which is already present in the body, then it is called endogenous infection. For example, let us talk about bacterial vaginosis. This is an infection seen in the vaginal tract of female patients. Vaginal tract, as I said, there will be many organisms present as normal microflora. Some of them are opportunistic pathogens. For example, your Candida fungi is there, Gardnerella, which is a bacteria, Fusobacterium, Bacteroides, Peptoceptococcus, Lactobacillus, Eubacterium. All these are in fact normal microflora in the vaginal tract. But if some imbalance takes place in the vaginal environment, pH imbalance, so ಇನ್ನೇನೋ ಒಂದು ಆಯಿತು ಅಂತಂದ್ರೆ these organisms will start multiplying, proliferating and cause certain disease like bacterial vaginosis. Okay, so such an infection which is caused by the organism which is already present in the body is called an endogenous infection. Organism ಹೊರಗಡೆಯಿಂದ ಬರ್ತಾ ಇಲ್ಲ, ಬಾಡಿ ಒಳಗಡೆ ಇರುವ organism infection cause ಮಾಡಿದ್ರೆ, that is called endogenous infection. But exogenous infection is an infection caused by organisms not normally present in the body but which have gained entrance from the external environment. Such an infection is called exogenous infection. External environment antandre it could be from the air or from water or from food or from another human being, from blood and body fluids. So ee tara ಹೊರಗೆಯಿಂದ fomites ಇಂದ, furnitures ಇಂದ, inanimate objects ಇಂದ ನಮಗೆ ಒಂದು ಇನ್ಫೆಕ್ಷನ್ ಬರುತ್ತೆ ಅಂತಂದ್ರೆ ಆರ್ಗಾನಿಸಮ್ is entering from external environment ಅಂತ ಅರ್ಥ. So such an infection is called exogenous infection. These two terms are very important for you to understand. These two are cross infections. One is nosocomial infection, the other one is iatrogenic infections. Nosocomial infection is the infectious diseases that are acquired or developed during a hospital stay. See, this type of, or you can simply call it as hospital-borne infections. During the hospital stay, when you get an infection, when you see an infection freshly happening in a patient, he is not admitted after the infection. He might have been admitted because of some other reason, but after his admission in the hospital, if he gets a new infection from the hospital environment, then that is called nosocomial infection. So, illi infection can happen in two ways. One is because of some procedure carried out by the physician or the doctor. ಅದು ಸರ್ಜಿಕಲ್ ಪ್ರೊಸೀಜರು, ಇನ್ನೊಂದು ಡಾಕ್ಟರ್ ಮಾಡುವ ಯಾವುದೋ ಒಂದು ಪ್ರೊಸೀಜರ್ ಇಂದ ಇನ್ಫೆಕ್ಷನ್, ಹೊಸದಾಗಿ ಒಂದು ಇನ್ಫೆಕ್ಷನ್ ಆಗ್ಬೋದು. ಅಥವಾ the infection may be happening from the hospital environment. Maybe it is from some inanimate object or from some medical equipment or from other patients or from the medical personnel itself, nurses in the, attenders in the, or from the visitors who are coming to visit the patients, or from air and water that is being used in the hospitals. Because of all this, if you get a new infection during the hospital stay, then such an infection is called nosocomial infection. So usual type of nosocomial infection will involve the urinary tract, the respiratory tract, or the blood mainly. So the common organisms that cause nosocomial infections are these. Gram-negative intestinal flora like Escherichia coli, Klebsiella and Pseudomonas, whereas the and also Salmonella. And viruses like hepatitis B and influenza virus, also hepatitis B usually gets transmitted through blood or serum. So our infection in the hospital environment during transfusions might happen. And influenza virus, which very easily gets spreaded through air. So that virus also can infect in a hospital environment. And of course, Mycobacterium tuberculosis. This is very commonly seen nowadays as nosocomial infection, which also gets spreaded through droplets. So from one patient who is suffering from TB, the organism can easily enter another patient who has been admitted for some other reason. Okay, so all these infections can be caused in a hospital environment. So they are all can be given as examples for nosocomial infection. But the second term here is iatrogenic infections. This is physician-induced infection resulting from investigative, therapeutic or other procedures. See, idu kuda ಒಂದು ಡಾಕ್ಟರ್ ಮಾಡುವ ಪ್ರೊಸೀಜರ್ ಇಂದನೇ ಬರೋದು. Doctor may be doing some kind of scanning or endoscopy anta ಮಾಡ್ತಾರಲ್ಲ, where they insert the scopes inside the body through mouth or through nose or through anus. So ಈ ತರ ಎಂಡೋಸ್ಕೋಪಿಕ್ ಪ್ರೊಸೀಜರ್ಸ್ ಇಂದ ಅಥವಾ ಕ್ಯಾಥೇಟರ್ಸ್ ಹಾಕ್ತಾರೆ ಯೂರಿನರಿ ಟ್ರ್ಯಾಕ್ಟ್ ಅಲ್ಲಿ, ಯೂರಿನ್ ಕಲೆಕ್ಷನ್ಗೆ ಕ್ಯಾಥೇಟರ್ಸ್ ಹಾಕ್ತಾರೆ. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ಆಲ್ ದೀಸ್ ಪ್ರೊಸೀಜರ್ಸ್ ವೇರ್ items are continuously used after sterilization, and if the sterilization procedure is not done properly, infection can be transmitted through these equipments also, and even from the physician hands. Sometimes physicians patients ನೋಡ್ತಾನೆ ಇರ್ತಾರೆ. ಯೂಶಲಿ ಒಂದು ಪೇಷಂಟ್ ಆದ್ಮೇಲೆ ಇನ್ನೊಂದು ಪೇಷಂಟ್ ನೋಡುವ ಮುಂಚೆ they will do all sanitizing procedures, but sometimes if the patient number is more, sometimes negligence in the physician hands in the infections ಒಂದು patient ಇಂದ ಇನ್ನೊಂದು patient ಗೆ ಹೋಗಬಹುದು. So in such cases we call that as iatrogenic infections. But you might ask me a question, ಇದಕ್ಕೂ nosocomial infection ಗೂ ಏನ್ difference? See, the main difference is here the patient may or may not have been hospitalized. ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಸ್ಟೇ ಮಾಡಿಯೇ ಇರಬೇಕು ಅಂತ ಏನಿಲ್ಲ. ನೀವು ನಾರ್ಮಲ್ ಆಗಿ ಔಟ್ ಪೇಷಂಟ್ ಆಗಿ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬಂದಿರ್ತೀರಾ, ಸರ್ ಡಾಕ್ಟರ್ ನೋಡಿರ್ತಾರೆ, ಕಳಿಸ್ತಾರೆ ಮನೆಗೆ. ಸೊ ಆ ಟೈಮ್ ನಲ್ಲಿ ನಿಮಗೆ ಇನ್ಫೆಕ್ಷನ್ ಆಗ್ಬೋದು. ಅಲ್ಲಿ ನೀವು ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಸ್ಟೇ ಆಗೇ ಇಲ್ಲ, ಯು ಹ್ಯಾವ್ ನಾಟ್ ಬೀನ್ ಅಡ್ಮಿಟೆಡ್, ಸ್ಟಿಲ್ ಯು ಹ್ಯಾವ್ ಗಾಟ್ ಅನ್ ಇನ್ಫೆಕ್ಷನ್ ಫ್ರಮ್ ದಿ ಹಾಸ್ಪಿಟಲ್, ಫ್ರಮ್ ದ ಡಾಕ್ಟರ್ or from some procedure carried out in the hospital. So such an infection is called iatrogenic infection. So as I said, after any medical or surgical managements like catheters, transfusions or transplants, you might get such iatrogenic infections. So the last classification of infection I would like to highlight here is based on the prevalence of the disease in the society. Under that we have 4 very common terms used: endemic, epidemic, pandemic and sporadic. Endemic diseases, the diseases which are constantly present in a particular area. In a small area, this disease is constantly present in a small population. For example, typhoid fever. Typhoid fever is endemic in most parts of the country, that is India. ಅಂದ್ರೆ ಇಲ್ಲಿ ಪೇಷಂಟ್ ನಂಬರ್ ವಿಲ್ ಬಿ ವೆರಿ ಲೆಸ್. ಒಂದು ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಅಲ್ಲಿ ಒಬ್ಬರಿಗೋ ಇಬ್ಬರಿಗೋ ಇರ್ಬೋದು, ಇಲ್ಲ ಒಂದು 10 ಜನ 20 ಜನಕ್ಕೆ ಇರ್ಬೋದು, ಬಟ್ ಇರುತ್ತೆ. Throughout the year you will see typhoid infection happening in many parts of the country in a very small population. So such an infection is called endemic infection. So typhoid illa India nalli anta helak agude illa. ಎಲ್ಲಾದ್ರೂ ಒಂದು ಪಾರ್ಟ್ ಅಲ್ಲಿ, ಎಲ್ಲಾದ್ರೂ ಒಂದು ಸ್ಟೇಟ್ ಅಲ್ಲಿ, ಸಿಟಿಯಲ್ಲಿ ಇದ್ದೇ ಇರ್ತಾರೆ, ಕೆಲವೊಂದು ಪೇಷಂಟ್ಸ್ ಇದ್ದೇ ಇರ್ತಾರೆ. ಸೊ such an infection is called endemic infection. Second is epidemic infection. The infection which spreads rapidly involving many persons in an area at the same time. ಅಂದ್ರೆ ಎಂಡಮಿಕ್ ಆಗಿರುವ ಒಂದು ಇನ್ಫೆಕ್ಷನ್ ಸಡನ್ ಆಗಿ ತುಂಬಾ ಜನಕ್ಕೆ ತುಂಬಾ ಕಡೆ ಸ್ಪ್ರೆಡ್ ಆದ್ರೆ, ಒಂದು ಪರ್ಟಿಕ್ಯುಲರ್ ಏರಿಯಾನಲ್ಲಿ, ಇಂಡಿಯಾನಲ್ಲಿ ಸಡನ್ ಆಗಿ ಒಂದು ಇನ್ಫೆಕ್ಷನ್ ಜಾಸ್ತಿ ಆಯ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಅನ್ ಎಪಿಡೆಮಿಕ್ ಇನ್ಫೆಕ್ಷನ್. ಇದು ಕಾಲರಾನು ಹೇಳ್ಬೋದು, ಟೈಫಾಯ್ಡ್ ಹೇಳ್ಬೋದು. ಹಿಯರ್ ವಾಟ್ ಐ ಹ್ಯಾವ್ ಶೋನ್ ಇಸ್ ಇನ್ಫ್ಲೂಯೆನ್ಸಾ ಡಿಸೀಸ್ which causes winter epidemics in cold countries. For example, US alla nodidre winter season alli ee flu disease enideyalla, flu infection tumba rampant agi tumba janakke barutte. So that is an epidemic. Okay, the next one is pandemic. An epidemic that spreads through many areas of the world involving very large number of people within a short period. ಇದು ಡೆಫಿನಿಷನ್ ಪ್ರಾಪರ್ ಆಗಿ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಹಿಯರ್ ಇಟ್ ಇಸ್ ಅನ್ ಎಪಿಡೆಮಿಕ್, ದಟ್ ಮೀನ್ಸ್ ಮೆನಿ ಪೀಪಲ್ ಆರ್ ಅಫೆಕ್ಟೆಡ್. But what is the difference? Epidemic is happening in one specific area at one specific point of time, right? Whereas pandemic is, it happens to many people throughout the world in many areas. And the infection spreads very rapidly within a short period of time. So such an infection is called pandemic infection or pandemic disease, because it usually results in disease. And I don't think I will have to give you any example here. You already are in this situation, so you know the example. The last one is sporadic. Diseases that are seen only occasionally and usually within geographic concentration are called sporadic diseases. Andre, this also is an infection seen in a very small area. ಒಂದು particular location ಅಲ್ಲಿ ಬರುವ disease, but ಇದು ಎಂಡಮಿಕ್ ಆಗಿ ಯಾವತ್ತೂ ಇರುತ್ತೆ ಅಂತ ಇಡೀ ವರ್ಷ ಇರುತ್ತೆ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ. At occasionally it comes and goes. So such a disease is called a sporadic disease. For example, cholera and rabies. ಇದೆಲ್ಲ sometimes sudden ಆಗಿ ಒಂದೊಂದು ಕಡೆ ಕಾಣಿಸುತ್ತೆ and then it disappears. So these are the terms which is commonly used in epidemiology to explain the spread of the disease in the community. Now it is the question time. I am giving you a new term here called breakthrough infection. We are seeing this term nowadays in newspapers and also in social media. Find out what is it and write to me. Also find out 5 more types of infection which has not been explained in this video, and write a mini assignment on that too. Okay? See you.